Good morning, everyone. Scott Mabor here with your Medicare Missive from the pond. So I am back at home for Wednesday, July 1st. Happy July, everybody. Hope your summer is going well. So today is the first day Medicare will cover a GLP-1 for weight loss. Prior to this, and this is the GLP Bridge program, prior to this, Medicare did not cover it for weight loss. Starting July 1st today, if you have any Medicare Part D plan, it doesn't matter whose plan you have or what plan you have, your GLP-1 for weight loss will be covered. However, depending on your BMI level, there may be other requirements. So if you have a very low BMI or relatively low BMI, you may also have to have asthma. You may also have to have sleep apnea or a heart disease. So the higher your BMI, the less of those you need. But if your doctor says you qualify, you have these comorbidities, you can get a GLP-1 for $50 a month. That's a significant savings. It will help a lot of people. However, a couple things to keep in mind, and if you're on my mailing list, you got this email this morning, but a couple things to keep in mind. One, you cannot initiate. The provider that's prescribing the drug has to initiate, and there's a process through CMS that CMS established that they have to go through to get you the $50 per month GLP-1. Two, it goes through Humana. No matter who your drug carrier is, this is not a Part D benefit. You have to have Part D, but it goes through Humana no matter who your particular Part D carrier is. They're the administrator of the program. Three, it is a temporary program. So this particular program, the Bridge program, ends December 31st. Then it becomes something else. Open enrollment will be really critical if you want to stay on this program, or whatever they're calling it in January, I can't remember. Because in January, so during open enrollment, when you're picking your plans for January, you need to pick a plan that's participating in this program. I have no idea how many that's going to be. It may be a very limited number. Originally, the plan was every carrier would offer this as part of the Bridge program, and many of them said, no thanks. We don't know how much this is going to cost us. So we'll have to see what happens in the fall. The other thing to keep in mind is that the program ends December 31st of 2027. So if they don't extend it, at that point, your coverage for GLP-1s, or you have no coverage for GLP-1s if they don't modify the program. Currently, or as of yesterday, there was no GLP weight loss coverage with Medicare, and a GLP-1 was a few $100s a month. You could conceivably go back to that and not be able to afford it, and all of a sudden you have to go off the drug, and potentially your weight goes up. So keep that in mind as well. If you have any questions or problems, let me know. I'm happy to help. But just remember, your provider has to put in the paperwork for this, not you. The reason I was away, if you've seen any of my other videos in Chicago, I was in Madison, Wisconsin for long-term care training. The name of my company is Senior Benefits Boston. Boston may be unfortunate, but it's there. But Senior Benefits, and my focus is Medicare, but I also have expertise in Social Security. I'm a registered analyst, and I do long-term care. So the three pillars of your, not retirement planning, not financial planning, but the three pillars: health, income, and long-term care needs, which is related to health, but since Medicare doesn't cover it, it's an entirely different topic. Let me know if I can help. The conversations I had in Madison, Wisconsin were fascinating. There are so many new products available in the long-term care space, covering all range of budgets. So there are short-term care plans, which are less expensive and easier to get, and then there are the very fancy hybrid plans. But depending on where you are in the spectrum, health will determine what you qualify for, because not everybody qualifies for these plans, and what your budget is. And ultimately, you may decide it's not in the budget, Or the carrier may decide there may be no carrier willing to take you based on your health. So it's an initial conversation to see if you qualify and how much it would cost if you do. If you don't qualify, there's no reason to have a conversation. If you do qualify, which plans do you qualify for? What are your options? What are the costs? It may be in the budget, it may not be. But I would urge you to consider, how are you going to pay for your long-term care? Medicare doesn't pay for it. So whether that's at home, whether it's in a facility, it's extraordinarily expensive. And statistics from the government say 70% of those 65 plus will at some time in their life need some long-term care. And long-term care is any care lasting more than 90 days. Not very long. Let me know if I can help. Let me know if you have any questions. And have a great day. Thanks for watching. Share with your friends. And be well.